Okay, hi everyone. Thanks everyone for the great talk. My question maybe is for Suifan and maybe Lynette. Just wondering, maybe you can share more about how you actually navigate and transit from like medical or like doctors to service design, because I would think that they actually have very different focus or like different directions when it comes to like serving the patients. Yeah, so it would be great if you can share more about that. Yeah.
Yeah, I do distinguish between patients and persons, right? So when you come into the hospital, you are entering a space with a culture. It's a very strong culture. Even within the space, right, there are higher cultures. Example, you walk into an OT, right, operation theater, okay, you can't walk in. You got to take off your shoes, you got to change your clothes, you got to wear a cap, you got to start gowning up, right? And then once you're inside there, you can't touch anything you like, right? Everything has a protocol and everything has a checklist because nothing can go wrong. Lives depend on it, right? So checklist culture is very strong there, okay? And control to make sure that if you put in this input, you will get this outcome. Then they took the checklist and they put it in the ward, right? And then they want to ask, which patient has gone to the toilet, has been bathed, which has eaten and all that. So they checklist this, right? Honestly, all you have to do is just ask the patient. They used to ask the patient and develop a relationship. They stopped that because they just checklist, right? So no more relationship. Then patient says, why my care so lousy? Nobody cares, right? They just treat me as a lump of meat that needs to be processed. Yeah, so we have to balance this. So that is a culture in an episode of care. It is a short-term period, at most weeks, right? Most times is a few days, right? In that short period of time, you don't mind being subjected to a culture where you conform, but the rest of your life you won't want to live like that. And honestly, when I went to the dental chair, right, she said, open your mouth. She said, lie down. Lie down. I also became institutionalized in my behavior, right? Because I understand this culture is for my safety. Yeah. But this culture is not for my life. So innovation must take different viewpoints when you look at changing care in the acute hospital. There's a certain culture you must understand, but once you're out, right, you cannot take that same assumption and solve it that way. And a lot of us forget. Yeah. So I don't know if that answers your question. Yeah.
Yeah, thank you.
Okay, sure. Yeah. Mine is more of a personal story. Yeah. So I joined healthcare because I like to serve, right? Yeah. Just now when I started the sharing itself, I shared with you a little bit of my career history. So when I joined Tan Tock Seng, one of the sad things that kind of like um, uh, kind of like brought me right to a whole new level right of upsetness over the system is actually my own dad. Yeah, so he was a stage 4 cancer patient and he was admitted to the hospital that I work in, and he waited in the emergency department for 40 hours. 40. I was his caregiver, I was his loved one, right? The anxiety, the frustration, the lack of comfort that I saw in him, um, the care level by the medical professional, by the nurses were there, but they really have too many patients to look after. And back then, I was still in the operations department. I almost wanted to resign. How can the hospital that I work in this way, right? And I told myself, um, I probably need to do a switch so that I can effect, right, a bigger system change. Yeah, this can't do. Yeah, and nobody came and asked me, how are you feeling? Yeah, what matters to you? like what Sui Fan say. Yeah. So this experience, which is 16 years ago, till this date, it is still very, very fresh on my mind. I will never forget. Yeah. And that's when I decided to join Kaizen. And I used the lean knowledge that I acquired in the earlier hospital and brought in design. Yeah. To make the changes that I wish that my fellow colleagues will see together with me.
Okay, thank you for sharing.
Wow,
Stress, right? Holding the.
great. All right, I'll do it.
Hi, thanks for sharing. So my question have some slight similarity with that one. When you do transformation or service design, I imagine you might face resistance from the staff. And then how do you navigate that? Or you can share us some stories about how you do that. Yeah. Thank you.
You have the. It's fine.
Okay. I would say the most immediate thing people would do is to show data. Data never ever move anybody. You need to move the emotion. You need to tell stories. That was the story. Stories can break down resistance. Yeah, of course, stories are qualitative, and people will say you need a lot more stories for that to count. Yeah, and I think we do need ways to convince people where it's now recognized as thick data, right? Data with quality. And that's happening now, right? It's just we are not very good at it yet. But hopefully we can do that. And that's going to change the way we collect. But there are still ways of research that the medical fraternity is very, very familiar with. Globally, it's like double-blind, multi-centered, placebo-controlled, randomized trials. Yes, those are needed. Really very scientific, right? Those are reductionist methods. But if you want to talk about holistic change, right, you really need lots of data with quality added onto it. So most times for the community, it's easier. I just tell stories. In the hospital, it's a bit harder. Maybe Lynette, you want to talk about that?
I think in the hospital, when I first started the movement of embracing design, I was actually facing a lot of resistance from the clinicians. Yeah, and they were telling me, design, okay, it's just looking good, right? Yeah, but it's more than that. Yeah, so you have to move, right, quite a fair bit of small, big mountains, yeah, to get there. You have to do a field signature project and shows the impact. You have to evoke the empathy in them. You have to let them walk the path of the patients. You have to show the results, and you have to show the money. Yeah. You have to have the funding to make the changes through your compelling business case, and this is not a typical business case, right? Yeah. And you have to create that small wins. Yeah. And when you see result, give the recognition back to the care team. Yeah.
Will you have any comparative perspective from Germany?
Actually, I'm really impressed about what you were presenting and the work you were doing together. I don't know of anything similar in Germany. I think that is to empower the people and the people around the patient and to make them aware they have a chance to help supporting the health situation. It's somehow very easy. Yeah. But since we have those strong institutions who make us think that they can solve any problem, we have a hard time, I think you have a hard time also to convince the patients themselves that they have the power. And that is what I love. And that, what you were doing is to show examples of people who are actually taking that chance and changing their life in a very positive way. They probably didn't know about that before, that was possible. But you have to look at it. You have to look at the patient. You have to do those trips. You have to visit them. You have to really experience, put yourselves in their shoes, and really find out what drives them. And that is what we are trying to bring to our students, to not just look from one perspective, but try to get a holistic view on the whole scenery and see the human, and not just the broken leg, the broken arm, but actually see the whole surrounding. I like that very much. So I'm taking a lot home to Germany. That event.
Actually, I have one, just a very wild suggestion now, because I think we heard two great stories inside the hospital and how can we take health in the hands of communities. So maybe HPI could take these as case studies and invite, I was about to say Dr. Wong, so Sweet Fan Wong and Lynette Wong, both of them, and bring these case studies to HPI so that German system is also exposed to this, because Germany is trying very hard at institutional level some way, like digitalization and change, but change is not happening. So perhaps these infusions from outside could inspire in some way. So it's just a thought and a suggestion.
And maybe to also add on to your thinking about resistance, right? Resistance is not just in Singapore. I saw it in Mayo Clinic as well. So when we say care is in my hands, not in the doctor's hands, the immediate response from the doctor is, what do you mean that I am not the center of my patient's care? They feel really very insulted. Yeah. And honestly, if you see worldwide in all the disciplines, right, almost every discipline is decentering the expert. Art, for example, the artist is going into the community to build community, and they are talking about decentering art. That means the art is not important, but you're using art to bring community together. They haven't started to talk about decentering the artists yet. So I was very inelegant when I said demedicalized care. Everybody hated me for that. It's like, how can you, a doctor, go and talk like that, you know? Yeah. But honestly, when we are in the community, we need to demystify care. So when I was in Mayo Clinic, they asked me, what is it about what you do that needs the DR in front of your name? And that was a wonderful question. A lot of things, I don't need the DR in front of my name to do it. It's common sense. Anybody can do it. But when I put a quality to it, a healthcare quality to it, suddenly caregivers say, oh, I cannot look after my mother because the nurse say I haven't gone through caregiver training. Hello, my mother washed her mother's hair when she was bedbound. She didn't go for caregiver training. She did it out of love. My mother looked after her father with nothing, no caregiver training. So why do we qualify our caregivers by saying you haven't done it so you can't give care? They just do it. Yeah. So it's the same way that she looked after me when I was a child. She looked after her mother. So caregiving cannot be made mysterious, you know. It's a simple, common sense, loving chore. Yeah. So we actually even thought, right, oh, why do we need podiatrists? Can we call the manicurists to come into the hospital? We can do that, yeah? Right? So let's think a little bit about who can we collaborate with. Why? Let's not make it such a difficult thing. But if you're doing it in the hospital, then of course, you've got to make sure you don't cut the skin while you're actually cutting the nail. So there's some standards, yeah. But in the home, don't need. If I have a daughter manicurist, wonderful, podiatry problems all solved, right? So I think we can really relook at who are the real experts in the community and actually collaborate more. Yeah, so it is about pride. It's about pride of our own achievements, and we just need to decenter ourselves.
True.
Yeah.
Maybe I can add on to what Sweet Fan is sharing here. As Sweet Fan, you were sharing about the demedicalized, right? I think in the hospital, right, we have to learn how to humanize care. Yeah. So one of the project that we did, right, and at the national level, was to see how we can, right, reduce the need for more dialysis center. Dialysis center are very expensive to run, and they are money losing. That's why they are always asking for charity money. And the patients, right, who undergo hemodialysis in the dialysis center, actually, they will need to be there for very long hours. Yeah, so it affects their employment opportunity. Yeah. So one of the project that we was asked by MOH to do was to look at how do you design a system that brings people, right, to accept what we call as peritoneal dialysis, yeah, in which they can do it themselves at home, and they will be able to lead a near normal lifestyle. Yeah. So in the hospital setting, healthcare professional thought that, right, okay, this is a dialysis patient, and I just teach this patient for 3 to 5 days, and their caregiver on how to do peritoneal dialysis, and there you go, you can do it at home. Yeah. So we organized, right, the value stream mapping, and we got them, right, the doctors, the nutritionists, the nurses, to go and see what's happening at the patient house. Yeah, okay. So in the hospital, when you learned how to do peritoneal dialysis, actually all the things that you need is just around you. Yeah, you just take, within your arm length, and the sink is next to you. But in the home setting, it's very different. The first thing that you step into the home of a patient who has accepted peritoneal dialysis is a lot of carton boxes. The carton boxes, right, it can be from here to here, okay? And it's this door. Yeah. And a lot of Singaporeans live in 3-room flats, 4-room flats. And once they are in these conditions, right, sometimes some family members bought hospital beds for them, and they will be living in the living room. Okay. The sink is not in the living room. Okay. The things that you need are cluttered by the sofa, by all the different furniture that you need. That's why when people go home, they have problem practicing what we call as infection control at home. So they will suffer the inflammation. Yeah. So these are the things that the medical professionals doesn't know if they never see. And this is how we let them see another angle. So there's another concurrent exercise. We made our dear dietitian be a patient, walk with patient. Okay, so we talk about patient-centered care, right? And you have to be very careful about this word. There's different version of patient-centered care. Yeah. The patient, we want to provide a one-stop center. This is in another hospital. This is national project, right? So we have to visit different hospitals to see what they do. So they had the different healthcare professional line out to see the patient. Yeah. A patient has to go through near 2.5 hours of meeting different healthcare professionals, from the renal coordinator to the nurse educator to the dietitian to the financial counselor. Honestly, by the time you finish everything, right, you are not absorbing anymore. Yeah. And the dietitian told me, finally, I understand why they are not listening to what they should eat. Yeah. So this is how we humanize care. Yeah. And that creates a breakthrough in how we redesign our renal care. Not just periodontal dialysis, but other aspect of how we design our house services. Yeah. Okay, I hope that helps. Yeah.
Thank you. I just want to say thank you to Lynette and Sifan because I'm also, I'm recently, in a few months ago, I was in the hospital with my grandma. I was in the A&E for 24 hours, so I think it's improved a lot. Yeah, and also you mentioned about the frequent flyers. My aunt is a frequent flyer of a hospital. So I do understand the problems that is having currently. I'm a caregiver for my mom who suffered a stroke last year. So I understand all the processes that in a hospital. I'm a designer myself, so I do see gaps in there and a lot of areas to be improved. I'm also thinking about like how can we improve the system because I'm very heartwarming to hear about the community that we are having in Yishun. I hope they will bring throughout the country because I think we need to really bring people outside of hospital because really the graph that you draw about like between the private hospital and the government hospital, so there might be some things that the private is doing well. And I see there's a lot of biasness as well. Example, my insurance agent will tell me that if you can pay for it, please buy a private hospital insurance because you don't want to wait in the A&E. Then again, I'm Singaporean, then I see that we need to support our own community and hospital. So how can we as young Singaporeans also to play a part and contribute? So this seminar, I mean, this event is really warms my heart because I do see that we can really contribute to the Singapore community. Yeah, thank you.
Thank you.
Thanks. I think maybe it'll be very good to maybe from both of you to get a comment on how can Singaporeans, like normal Singaporeans, contribute to the initiatives that you have, for example, if they wish to, even if they are not employees of, say, hospitals.
I'm going to say take charge of your own health. Yeah. So we used to teach our children to brush teeth. Imagine, right, if we didn't teach them that, we have to brush their teeth for them every day, twice a day. Right? So people can do this. Our nurses, when they first went into the homes, right, the first thing they do is always take out the BP set. So we asked them, why do you do that? And then they said, I don't know. I don't know why I do that. And it's like, after a while, one of them was courageous enough to say, I'm exerting my authority. So we need to relocate that authority back to people to take charge of their lives. So now they don't take out their BP set. Do you check your blood pressure regularly? Oh, you do. Can you show me? Oh, you haven't been doing that recently. Why ever not? Oh, I see your blood pressure set is broken. Can we do something about that? We are now seeing new problems. We're now seeing capability building. Yeah, I'm literally asking hospital, can we let our patients measure their own blood pressure when they're in the ward? After all, we teach them in the home. Then the minute they come into the hospital, we institutionalize them. Why? If we let them take their own blood pressure in the hospital, we are checking their technique. We are doing a back demonstration. Why wouldn't that be good? Can they do their own pain score? It's a visual thing, right? So if your pain score 2, Panadol. Pain score 4, okay, you can take Acoxia. Pain score 7, please go see doctor, right? They can make these decisions on their own. And I think we just need to demystify some of these things to help them take control of their own health. And I think they will be willing to do it. Yeah.
So, Swifang, I think it's coming. Yeah, we have to again move a lot of mountains to there. I mean, as you were saying that, I remember that we were doing a project in the integrated care hub, right? So it's supposed to advocate, right, new model of care every moment, every rehab moment. So I was telling the doctors and nurses, come, let the patient take their own medication. At home, they will do it this way as well, right? Yeah. And the amount of no, 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 yeah, is a lot of it. So I told them, why not try control study, control study, control study? Then it works. Yeah. So they have to, you have to give them you have to give our healthcare professional their familiar power, and yet, right, nudge them very gently to move towards trying out new things. Yeah. And once the selected group of patients really can do that, it actually gives them the confidence to expand the program. So things like that you have to try. Yeah. And coming back to the questions on what can we do as Singaporean, right? Other than taking charge of our own health, if you have a expertise that you think you can lend to the public healthcare, public health, volunteer your service. Yeah, I think that helps a great deal. Yeah.
Hi, I have a question. Maybe it's for the whole panel. So I'm just really interested in hearing, like, I guess the examples that Lynette as well as Sweet Fun have shared are about, like, you know, how we're solving these problems and how we're kind of like humanizing patient care once you go into, I guess, like, it's kind of like post-medical training, right? How are we kind of helping maybe our younger doctors with, like, maybe design thinking? Are we implementing such, I guess, like, ways of solving a problem so that they ask the right questions? And then I guess, I suppose, like, maybe when I'm old, when I'm like 60 years old, you know, I don't have to worry like, oh, these doctors don't consider these questions. Because I think, like, you all talked a lot about, I mean, both of you are just two examples, right, of many other doctors. I don't think all doctors think like that, for sure. So then it's a bit scary and worrying also if you know that you're going to be there like one day. Yeah, so I'm just curious. Maybe that can also be something that's solved by Prof. Uli's design thinking school. I don't know.
Maybe I can give a short response to that. So a couple of years back when I was moving, try to advocate for design in my hospital. And that was when the opportunity opens up for us to teach, right, the chief residency program. So residency is a program that teach the young doctors. Yeah. So through that, we actually influence, right, the need for them to visit the community as one of the program. Yeah. And let them see for themselves what on earth is happening at the community. Otherwise, they come to the hospital, they will just straight away being shaped into the medicalized care more. Yeah, yeah. So we teach them, we let them have the immersive experience, and we will remind them along their stint in the hospital, yeah, treat the patient as a person. Yeah, not a patient, as a person.
I can building on that, or actually adding to that. I think that has a lot to do with what we are doing in schools. I think we should empower young kids from the very beginning to be caretakers for themselves, to learn about that they can take care of their health. My son is sitting over there, and I'm talking to him a lot of times about nutrition, about what he's eating and drinking, and that brings me to another thing. So there is an industry, there's an industry, and we didn't touch that at all. There is the pharmaceutical industry. There's another industry which is selling us some things to eat and to drink, which are not healthy at all. But since everyone is doing it, we think we should do it. But I think the bigger pressure is coming from the pharmaceutical industry, which is supporting this kind of non-healthy system because it makes them sell their stuff well. And if we are taking care of and young kids already are taking care of their health, that will reduce the income of the pharmaceutical industry. So they are fighting against it. And I have seen that especially in the Corona crisis, where we had to be, we were all of us were victims of the pharmaceutical industry who they were testing things which were not tested. And we all believed, because the government, our government was saying, we have no other choice, we have to do that, and there is something, so please take it. So, and that was for me a wake up situation where I was seeing, okay, there is a huge industry making a lot of money with stuff which is very doubtful helping to our health. So, and empowering young kids from that should be a part of what they learn in school and what students learn and what is our everyday experience, to be empowered to care for ourselves and then look at our neighbors, and then maybe third or fourth step, you call it the third, so the fourth is
Space.
talking to the experts, who are sometimes really bought by the pharmaceutical industry. We just have to be aware of that.
I want to reassure you, it is not this or that. Not everyone needs to be a designer. Okay? If I needed brain surgery, I will go to the best expert with the best skill. Don't care if he can do design, just operate properly and get me out, right? Correct, right? And I will listen to him and I will do whatever he tells me to, or his team, because I want the best. There's a place in the world for this group of people. And they are very good brains, very good hands. And a lot of them are very caring too. Yeah? And then there are the people like me lah. Run around, what is she doing? Yeah, okay, yeah. And there are people along the full spectrum. Yeah? Not everybody needs to do design. Yeah? Some of the design is hidden in Kaizen. Right? It's just a different way of saying things. Honestly, all of us are designers because we are problem solving all the time. Yeah. That's why I'm accidental designer. Accidental in, because honestly we're just solving problem. Yeah. And so I think everyone who is human really, when they see a problem, they will solve it. So if I'm a surgeon and I'm doing brain surgery on Sui Fan, who demands that I'm going to be very good, if I see a bleeder, I'm going to do everything I can to do that and contain the situation. So I will let the surgeon do his job well. Yeah, so not to worry. Yeah.
Okay, I think let's take it as last question because I'm very mindful of time. We are much over. So last question, yeah.
Okay.
Rest,
hi all.
you can hang out after that as well
Okay.
and talk. But let's close the session.
Hi all. I understand design thinking and service design is a collaborative process, right? So I'm wondering, how do you guys create a safe environment for innovation and empowering individuals to give their own input into the process? Yeah.
Safe space is the same for everybody. Yeah. Be kind. Yeah. It may not be the right thing sometimes. There could be something better, but still be kind. And it's just feedback. Not everybody understands that. Some people think it's criticism. Yeah. And they are sensitive. Of course, if I come up with something and I think it's great, my baby dinosaur, and you think it's not, it's like, you're not my friend anymore. Yeah. So safe space is the same for everybody, whether it's in design or it's in competencies or in skills. Yeah. Or it is in just conversations with our children. Yeah. Being able to not be so serious ourselves. I think we are really very serious people. We need to have some time to experience what play is, right? I recently learned a lot of things. playing, what's it called? MTG, Magic the Gathering. It's like, oh my goodness, there are so many things in here I never knew, but there were things that were happening in my life. It's like, that's strategy. You have a totally different strategy, and that's so complex. But hey, I got strategy too. It's complex as well. And it's not the same, but yet we always have an element of chance. Life is like that. So safe space is the same for everybody. And I think it's understanding the other side. So whatever people say, right, it's about ask the right question. Always stay in the inquiry mode, right? Why do you say that? Instead of judgment, turn to curiosity. Right? Instead of defensiveness, turn to self-reflection. It's a posture that we can adopt. I hope that helps you.
I guess I will probably add on to what Sweet Fan said. Other than being kind, respecting one another opinion, if you are working in a large enterprise, right, it is also walking the talk. Yeah. So if the senior leadership is showing the same level of respect, agreeing to disagree, and be kind, I think that talks a lot. Yeah. And we do have to be the role model for many colleagues. In fact, I believe it's the same culture in KDPH as well. When we go down to the ground, I will candidly tell the nurses, tell me what you do. I may not know what you do. Yeah. Educate me. Yeah. And it is very, very heartening, right, to hear what they say. There's no right, no wrong. Yeah, it's how you see it and how you help one another to be better in the work that we can do to serve our patients. Yeah.
Okay, so I think I would like to bring this informal session formally to a close. But before that, I have 3 takeaways from me. There are a lot of wise words that have been said. But would you like to summarize one message that you would like to give in one line? Lynette, Uli, and I'll still call you Dr. Wong. That's one line message for everybody.
Unlearn to relearn.
Wonderful. Unlearn to relearn.
Train your IQ and build bridges to other IQs to generate a VQ.
Wonderful.
I'm going to say, choose your container.
Wonderful.
Define who you are. You can be different people at different times. You are unlimited. In the words of my most famous philosopher, my daughter, you are an unrepeatable phenomenon. That's what she told me. That's why I call myself Sweet Fun and not Dr. Wong Sweet Fun. I am unlimited.
All right. Beautiful. Unlearn to relearn, IQ to VQ, and choose your own container, and many other things you said. But what I could what I was like, from all 3 of you, there are many things you said, but from humanized care is one for me, and then my health is everyday decisions that I make for myself is second, and be kind. Thank you very much, 3 of you, and thank you very much, all of you, for being here.